Hi, name's Greg Bradford, and today is my April the 1st COVID-19 broadcast here. We're going to update you on the status of Alabama's COVID-19 situation, and let's get started. I don't have a teleprompter, so I'll be looking down at my phone occasionally to remind myself of what I'm talking about. So let's get started. First of all, Alabama has run to date, as of April the 1st, 2020, 7,744 tests. Out of those tests, we've had 1,084 positive cases of COVID-19 as of about 5 o'clock April the 1st. Now, that's up 102 cases from yesterday, March 31st. So that's a little bit over 10%, maybe 11, maybe 12%. And that's not tremendously high, but it's higher than we want, obviously. Now, going on to the case by case for the counties, let me find you a few details here and cover those. So in the last 24 hours, there have been no counties that have come in that have had 0 cases prior and come in with a new case. So there's been no new counties reporting a confirmed case. By the way, just so you know, the Alabama Department of Public Health website only reports confirmed cases, possible fatalities, and confirmed fatalities. Now, I may say the word deaths interchangeably with fatalities, but same thing, okay? Okay, so no new counties came in with a case. And let's look at Chambers County. They had 8 new cases to make them a total of 45. Now, for Chambers County, with the population that they've got, 45 cases, that's a good many cases. So I don't know what's going on down there. You good folks down in Chambers County, you might want to consider doing a little bit more social distancing. Perhaps that might help. But 45 cases in Chambers County, that's a good bit. And moving on to Jefferson. Jefferson's got 299 cases. As of April 1st, that's up 29 cases from March 31st. That's a 10% rise right there. A good bit of Alabama's rise in numbers is due to Jefferson County, quite frankly. I haven't looked at they're about a third of Alabama's cases, new cases, as in the last 24 hours. 29 out of 107, a little bit under a third. Lee County, 82 cases, up 7 from yesterday. Not sure what's going on down in Lee County either, but could it be, I think that's the Auburn-Opelika area, if I'm not mistaken. Could it be that you got students who went on spring break and came back with the disease? Could be, hard to say. Certainly don't want to pin it on anybody or anything, but you could look at it that way. But then why doesn't Tuscaloosa have the same sort of numbers? So there you go. Madison County, they were up 8 cases to 107. Madison County's got a lot of travel back and forth to Washington, D.C., a lot of travel to places like Houston, Austin, West Coast, and a lot of defense industry travel. And the size of Madison County, it's not surprising that they got 107 cases. Now, Mobile County, Mobile, for the size that it is, only has 56 cases, confirmed cases. And that's up from 4 from yesterday. It's not a huge number. The folks down in Mobile are doing a good job with it. Keep it up, and hopefully you'll make it through this with flying colors. Montgomery, 35 cases, 6 of them being new. So you would think Montgomery might have a little bit bigger number of cases. Could it be they're not testing as much? But certainly they're the place where our state government runs from, and you would think there'd be a lot of people moving in and out of Montgomery for that purpose alone. But so far so good for Montgomery. So keep up the good work, Montgomery. Randolph County, I'm including it. It's not a lot of cases down there. They went from 2 cases to 5 cases overnight. That's a pretty big increase. That's a 150% increase. So even though it's small numbers, it's still a 150% increase. So be wary down in Randolph County. Stay in your house. Be careful with what you do when you have to go out. We all have to go out. And just make sure you wipe those hands down when you get back in the car. Stay out of the stores as much as possible. Get what you need and get out. Don't take anybody extra with you, okay? There's no point in it. Moving on to Shelby County, they had 3 additional cases to make a total of 89. Now, Shelby County is kind of an interesting case. They're right next to Jefferson County. Jefferson County having a lot of cases, and Shelby County has a lot of population as well. So for Shelby to only have 89 cases, they're doing pretty well with their social distancing down there under the circumstances of the size of the population and the proximity to Jefferson County. Okay, that covers the cases, and I'm going to move on to possible deaths. Now, possible deaths, Alabama put a new column in their statistics a couple of days ago where they're now tracking what they think is probably a COVID-19 fatality, but they haven't confirmed it yet. Okay, so everything looks like it's been a COVID-19 fatality. They just got to confirm that that's the case. Okay, so these are just possible cases. Baldwin, Etowah, and Houston County all had a new possible case. Possible fatality. So that's unfortunate for those folks, okay? Really hate to hear it, quite frankly. Jefferson County, they had another possible fatality. That brings them up to, of their 4 fatalities, 3 of them are possibles with 1 confirmed. Now, I'll cover it again in a moment. And the last but not least is Mobile County has another possible fatality, making 3 in total. By the way, just so you know, on occasion, Alabama reclassifies cases and fatalities. They might move a case from one county to a different county, or a possible fatality to another county. Better information comes in. You have to understand this is a kind of a transient situation where not everything is written in stone, okay? Wherever the person passed away at, perhaps the staff there at the facility thought the person lived in this county, but actually they didn't. They lived over in this other county. And honestly, I don't know how Alabama is counting everything, but I am going to tell you the numbers, occasionally the cases will go downwards. Maybe 1, maybe 2. Most I've ever seen actually 1 over a 24-hour period. The number went down 1. It's happened several times. Okay, it's a little disturbing at first, but then once you understand these numbers are not set in stone, they're subject to change. And once you get that, you're good to go. Okay, so we've covered possible fatalities. Let's go into confirmed fatalities. Chambers County has had a new confirmed fatality, making their confirmed fatalities 4. Now, I covered Chambers County a few minutes ago with the cases and said that I think it was something like 39 cases, maybe it was 36, but it's in the 30s, higher 30s. And I was saying, I'm not quite sure what's going on down there, but 4 confirmed fatalities, that's a lot of fatalities. Hope you guys get better down there. Okay, it's a tough time. Jefferson County has had 1 confirmed fatality from COVID-19. Mobile County has had a 2nd confirmed fatality. Even though their number of cases is fairly low for their population size, and the fact that Baldwin County is right next door to them as well, okay? 2 confirmed cases, fatalities with a lower number of cases. Once again, that's a pretty high fatality rate. And the last county here I'm going to cover today is going to be Washington County. They had a confirmed COVID-19 fatality. So I'm going to reiterate, I always do in my daily post, that these numbers are, especially the case numbers, are a bit dubious. The fatalities, I'm not going to say they're dubious, no, absolutely not. They're the most rock solid numbers that we got. But the cases are a bit dubious because we honestly, I know you've heard this, but we honestly don't know how many cases are out there of this disease. We just know what's been tested. We hope that our testing is correct, and we know we're not testing enough. We wish we could send a test out in the mail to everybody and let everybody test themselves once a day. We can't do that. So we have to depend upon a sampling and what people bring into us, and that's all we get, okay? And let's see if there's anything else here. If you go to the website, I'm sure you reached this video from the website. You'll find trends, 3-day rolling averages, 7-day rolling averages, 14-day rolling averages, and 21-day rolling averages. Now, I don't think the 14 and the 21-day rolling averages have actually had enough data to fill them out yet. So if you don't see any numbers reported for a 14 or a 21-day rolling average, just understand that I haven't been collecting the data long enough to actually compute that rolling average. Now, so you know, in all of these rolling averages, let's just take the 3-day rolling average for example. The rolling average is defined as the last observed date of data plus the prior 2 days worth of data divided by 3 to get an average number for those 3 days. You can find the last day collected at the top of the website there. It'll plainly tell you when it was collected, and that way you'll know what you're looking at. Now, the rolling averages are not predictions. They are just trends of what have happened. So they will lag the actual data by a few days, especially when you get into the 7, 14, and 21-day rolling averages. But you'll be able to see the curve smooth out with the rolling averages. Okay, it kind of takes some of the jumpiness out of the data. Not that there's a lot of jumpiness in the data right now anyway. We're getting about 10% more new cases every day. Once again, we don't know exactly what's going to be going on with fatalities yet. We haven't really started getting into a lot of fatalities yet, so can't develop any trends on that yet. So that's my summary for the day. Thank you for your time. Thank you for listening. Be safe out there. God bless you, and stay away from everybody, okay? That's what I'm doing 21 days straight now. Talk to you later. Bye.